Welcome, welcome, welcome. This is Peter Winnick. I'm the founder and CEO of Thought Leadership Leverage, and you're joining us on the podcast today, which is Leveraging Thought Leadership. This is one of our episodes where we're talking to organizational thought leaders, so a little bit different than what we normally do, but these are folks inside of large companies that are tasked with developing, deploying, or curating thought leadership for their company. So today my guest is Nicole Truhe. She's the Director of Thought Leadership at United Healthcare, Community and State. They serve over 6.45 million Medicaid members in 30 states plus DC. Nicole leads the development and management of thought leadership strategies for the organization, specifically focusing on emerging health and human services policy and practice trends in business growth. Prior to joining United Healthcare, Nicole served as Government Affairs Director for America Forward, where she led policy strategy and advocacy efforts related to pay for success, evidence-based policy, workforce, development, career, and technical education, higher education, and social innovation. She has a BA from Rhodes College in Memphis and a master's in public administration. So I'm excited to talk to you today, Nicole. How are you?
I'm doing great, Peter. How about yourself?
Good, all things considered. So let's start with definition. So everybody throws around the term thought leadership. How do you define it? And I'm assuming it's aligned with how United Healthcare defines it. But how would you define thought leadership as?
Sure, I appreciate that, and I have to be honest. I think it's a term that does get used and overused in some instances, and does certainly has a variety of meanings based on how one's utilizing it. So we at United Healthcare Community and State think about thought leadership in a couple of ways. One of it, and the way we define it and operationalize it in a couple of ways. One is about being able to look around the corner about what's coming for the space, and in our case, what's coming in terms of healthcare trends. And that's a very internal thought leadership mechanism, but it's about sort of, again, that looking forward, looking long term, looking around the corner. The second piece of it, and the way we define it, is more the external and probably the more traditional way people can conceive of thought leadership is how are we deploying our experts, our subject matter experts, to both educate the space about policy issues relevant to particularly the Medicaid and Medicare spaces, and how are we helping to then identify the way in which we are as an organization being responsive to or responding to those policy issues and trends. And that's usually through our clinical implementation activities, our partnerships, our collaborations, et cetera. But they very much work hand in hand, because those things that we are thinking about as being around the corner, sort of the next wave, next phase of the trends in healthcare, are where we tend to deploy our thought leadership, thought leaders. We do obviously look at the bread and butter components and have folks who are experts at sort of the primary parts of healthcare. But it's also about how are we showcasing ourselves as being those individuals who are thinking forward and looking ahead, and being front of leaning into where healthcare, particularly again Medicaid and Medicare, is going.
So it sounds like there's if I were to sort of summarize that, there's an influence element, and then there's an educational element. Is that a fair way to sort of split it?
Yeah, absolutely.
So two very different constituents, at least, right? So on the one hand, who are you trying to influence from a policy perspective to show your stake in the ground, et cetera? So it's probably more governmental agencies, funding sources, et cetera, right? And then the educational piece could be lots of different constituents in your system, from medical providers to end users, et cetera, right? So given there's a different needs, I mean, those are very, very different groups. How do you wrestle with sort of the various mediums and distribution, and, to get something to a new mother is different than getting to a message to a hospital administrator. So how do you thread that needle?
Good question. And actually, just to I think a caveat to how you just sort of framed it is the influencing, I think, is not just external, it's also internal, because a lot of times from an internal perspective, we can get myopically, not to use that word negatively, focused on the sort of day-to-day and what we know to be sort of traditional activities. What my role and what my team is focused on is, okay, we need to be able to stretch and think beyond sort of what we feel comfortable and sort of know as sort of traditional. And then on the external side, you're right that it's sort of those more kind of traditional healthcare
Mm-hmm.
professionals, providers, practitioners, but a lot of the trends in healthcare are around the integration of
Sure.
healthcare and housing and social services. So it's also a wider berth of individuals that we're looking to educate as well as be educated by. In terms of the medium, that's actually what I spend a lot of time, particularly with our communications and marketing teams, thinking about. And that's I
Mm-hmm.
think, a unique element to the role I play at United Healthcare Community and State is I sit on the policy and strategy team, not on the comms and marketing side of the organization. And so I spend a lot of time with them thinking about how do we package and what platforms do we utilize. So internally, it's one thing. How do you distill the information
Mm-hmm.
down for folks like our CEOs and our VPs who are being inundated with lots of content? How do you distill this information down to an absorbable amount and in a way that gets across the implications, risks, opportunities, challenges, why they should
Mm-hmm.
be focusing on this in addition to everything else? And that's both how you format and how you disseminate. On
Mm-hmm.
the external side, there's obviously much more, I guess, flexibility and
Sure.
creativity. So it's
Sure.
everything like, how do you use social media channels? How do you use multimedia channels? How do you use various platforms, both owned and earned platforms? And also, how do you utilize others to be a part of the messaging and or
Mm-hmm.
disseminate the messaging for you, so that you almost have like an honest broker validator element
Right.
to it, which helps to, I think, put a little bit of a moniker of, okay, this isn't just us sort of talking in our own
Telling our
vacuum
stuff.
or
Yeah. 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 Yeah.
exactly.
Yeah.
So who are those partners that we bring in close enough or that want to be in close enough to help either, again, partner and or carry the message in a variety of formats for us?
Got it. So two sort of reactions to what you said. A lot of great stuff in there. One is this myopic piece. So myopic tends to have a negative element to it. But when you actually think about it, most organizations, part of the problem is maybe siloed's a nicer word or something. But particularly when you have domain experts, they're deep in what they do and they mean well and they're tasked with doing their thing and they don't really know about the other thing, right? So engineers
Mm-hmm.
don't talk to customer service people and salespeople don't talk to marketing people. And it's not because of any ill will, but there is a tendency organizationally to reward people for what they do and keep people surrounded by people like them. So that myopic piece comes in. So it's interesting that, which is the second part of my thought here, that you sit in policy and strategy, right? So most people on the thought leadership world and the organizational side are typically in product marketing. There's a little bit of policy, but I would say the bulk, probably 70-80%, is sort of in that product marketing piece. And therefore, you're subject to analysis by typical marketing standards. The fact that your policy and strategy, I would assume, gives you a broader view across the system. Is that by design? Because that seems like a really interesting place to put you or your function.
Yeah, sure. And I mean, I guess to be candid or to just put it into perspective, this is one role
Yep.
within inside of a very large organization. There aren't others of me in other parts of the
Mm-hmm.
organization, and it is a brainchild of my boss. And I think what's critical about where it sits, and I think maybe unique to our sector, though maybe not, is healthcare is incredibly influenced, if not wholly influenced, by policy shifts at the
Sure.
state and at the federal level.
Yep.
And so a lot of our ability to be flexible and creative is in fact informed by and sometimes hindered by where the policy levers are or not in order to be pulled.
Mm-hmm.
So in one way, you look at it that really the thought leadership would only come potentially in a healthcare environment from the ability to influence and utilize policy in unique and different ways. And to
Mm-hmm.
be able to have somebody who sits and has a background, as I do, in policy, and to be able to make that translation is sort of critical to this not just being a typical marketing type
Yep.
of a role. But then to your point, and if again, not unique to healthcare, but healthcare in particular and the access to healthcare and providing
Sure.
healthcare,
Yes.
we know that it's so interconnected that
Right.
Your access dictates the care you provide, and the care that you provide is dictated by the provider network available. And so there's like interconnectivity to it that, again, sitting where I do, like you said, I think is helpful in order to be able to, because again, it's not just a policy team, it's a strategy team.
Yep.
And so we are embedded in all of our states. We are working across all of our business units in order to help support the strategy associated with our continued growth and development, which again takes multiple sectors and multiple layers.
And I would imagine that there are times or situations where the thought leadership is reactive to a change in policy, and there's another time where it's proactive, trying to influence that outcome, just depending on the cadence of things. If you're enjoying this episode of Leveraging Thought Leadership, please make sure to subscribe. If you'd like to help spread the word about our podcast, please leave us a review and share it with your friends. We're available on Apple Podcast and on all major listening apps, as well as at thoughtleadershipleverage.com/podcasts. I wanted to ask about, even if it's not embedded in a marketing function, right, your thought leadership function, at some level, like every organization, they have to look at it and say, how might we measure success, right? How do we know what good is, right? Whether it's KPIs or whatever. So what are the things that, I don't want to say that you're judged against, but how do we know it's working? How do you have confidence that it's working? And, it's because it's such a new field, sometimes you have to make the case internally. It sounds like you've got some really evolved leadership that actually created this role and a little bit of a moat for you to be protected from marketing. But ultimately, you still have to be able to say, okay, at the end of this year, here's some stuff I did and it worked and it didn't. How does that work?
And it's a great question. And to be honest, a lot of our KPIs are more what you would say is traditional marketing or communications KPIs, because other KPIs, for lack of a better phrase, are a little bit more fungible, and it's easily wrap your arms around it. So being able to say that we influenced a policy, which is obviously an ultimate goal,
sure.
You could make the argument that lots of people were doing that, or what part of your thought leadership was actually part of actually making.
So it's a contributing factor. It's not binary. You might say, yes, we had some role in the contributing factor of that policy change, but it's hard to say, was that 5% or 32%, right? It's squishy.
Right. It's not as clean as the other KPIs, which to your point are much more, as I noted, much more marketing communications related. How many clicks, how many retweets, how many more followers. But even with the followers point, it's not just 10 more or 20 more. It's who are those people? Are they influencers? Are they advocates themselves? Mm-hmm. Are they the policy leaders? So that layer would not be a component that, say, if this were just a traditionally sort of marketing lens or communication lens, would necessarily be wrapped around it. But it's important for those KPIs, though they're not necessarily, again, sort of at the policy strategy level, they are critically important because they help to make the case that this is working. This meaning utilizing this platform or utilizing these resources or utilizing these mechanisms are working and are getting us, driving people to us. And so by having those KPIs and being able to show that those data points, we continue to get the short support from leadership and the resources and essentially the go-ahead, the approval to continue, say, blogging or live tweeting or putting together these graphics or making these videos, which all take company resources, company time that could and potentially be diverted elsewhere if, in fact, it wasn't getting the clicks, the likes, the hits from individuals. And then I guess from an extension of that, Peter, which we haven't talked about, is when then are we getting invites to, say, write articles in journals or speak at events? Like those then are sort of the cascading markers that we look for. How are we then getting asked to participate in other people's venues? Again, whether it's journal writing or blogging or
so let's touch on that for a minute. So there's a piece where it's sort of inside of the universe that you have control over, right? That would be logical. But what you're saying is an interesting point. How often does another entity, another organization, another whatever come to you and say, wow, the thing that you wrote about that thing, would you mind writing for our people? Because we have a constituency that whatever it's disease prevention or whatever it might be. That's a wonderful validation that it's thought leadership and it's not marketing, right? Because another group's not going to come to you and say, can you take over our, space on our website or newspaper or whatever, and use that for marketing purposes, right? So there has to be respect there. You said something earlier that I wanted to open up a little bit, is that even though you're director of thought leadership, it doesn't mean that all the ideas have to be yours. There's a big curation piece. So you have lots and lots and lots of incredibly brilliant people inside of the organization. So I would imagine one of your challenges is identifying who they are, what they have to say, developing the relationships, and then a little bit of convincing them, like, hey, on top of the 72 other things you need to do, would you please? So how do you sort of extract thought leadership from inside the organization and something you curate it a bit?
Yeah. No, it's a really good question. I mean, I like to think of this, a lot of my role is relationship building and connecting. And I tend to, Malcolm Gladwell's book, Tipping Point, he notes people are connected. There's one of the categories of connectors. And I think that's critical to my role, is to be able to build relationships and to connect the pieces for people as to, okay, why on top of all the other things that you're doing, what are the dots that lead us to this being, helpful to you in your job, or helpful to, and most importantly, our members in sort of, providing them with the best type of healthcare that they can provide. So I spend a lot of my time just doing, and particularly when I first got here a couple of years ago, 30-minute conversations. What do you do? How do you do it? What is this role? Explaining what I did, explaining the relevancy, making those connections for people. And so, I mean, it's a simple response, but kind of critical and also I think showing the efficacy of the work. So sort of building some products and seeing the impact that it's had, that the blog has resonated in this environment, that it's gotten us X, Y, and Z activity. So
that was my next question is, so now you're developing rapport and relationships with folks that have these domain expertise, that you're sort of quarterbacking the utilization, and this would be great here. What is, I mean, it sounds hard, but what are they getting at? Is it the intrinsic, like, wow, I felt good writing this piece, and then I gave it to Nicole and she got it out there because I have the few, like, how do they benefit from it? The individual contributor.
Sure. And it depends on who it is, right? So
sure.
Our chief medical officer has, 20 plus years in the medical field, worked at Centers for Medicare and Medicaid Services. He's written and been authored pieces. He doesn't, this is not him looking to, necessarily need my support in order to do that. So for him, it's more about supporting, ultimately getting his perspective out there to help the broader healthcare system. So for him, it's a much sort of larger, how is he helping to influence and provide and push the healthcare system? For other people who are maybe coming up within the organization, it certainly is a way for them to sort of build their own sort of thought leadership, subject matter expertise. And then there's everybody in between, right? So it's, I think a variety of people see a variety of benefit, whether it's personal for them, professional for the organization, a combination of both, as well as I know that from a lot of the activities we've engaged in, it's sort of like a waterfall effect, right? You write one blog that gets you one conference speaking role. At that conference, you meet 3 or 4 people, and that those
they invite you, right.
May invite, but also more importantly, they might be relevant for some other project unrelated to what you were there talking about, that then helps another part of the business advance something. So there's a lot of synergy associated with the work, and ultimately how being willing, I mean, I think that's important that United Healthcare Community and State was willing to put resources into thought leadership, because it's not just about sort of pushing out our perspective and our content. It's what do you then get for the organization by being willing to be out there in that way and in those spaces and having those conversations? How do you then meet the people or learn about new ideas that are brought back in that ultimately help us and help our members be better and be more efficient, effective?
So as we're running out of time here, so let me just wrap with, if you were to advise someone new to a role that is similar to yours or could be similar to yours in sort of agnostic to the industry, right? It could be anything. What would you say are the couple things they should be thinking about, looking out for, et cetera, maybe in order to set the right foundation to build on over their first 6 months or so?
Sure. A few things. One is don't be afraid to ask lots of questions. I think it's important to, particularly in a role like this, because again, the way my role is envisioned, it is meant to look across and look above and sort of stay on top and be that big picture in perspective. So you've got to be able to be willing and not be afraid to ask the questions so that you can start to make those connections in your mind and then help make the connections for other people. I think too, is, as I said earlier, is whether it comes naturally or not to you, be willing to put those 30-minute coffees or conversations. I guess coffee is not necessarily this environment, virtual coffees in this environment. Do those relationships and take the time to actually sit down and learn from the others in your organization who will ultimately serve as your subject matter experts or your go-tos, say if it doesn't sit in comms or marketing, that own the platforms by which you put this content on. And I think 3, whether or not it's actually given to you in this way or not, and it was given to me in this way, is consider the work as a tabula rasa, like a blank slate. Like if no one had done this before, how would you structure? What would be your short, medium, long-term goals? And say them for yourself, but also say them out loud to others so that you can start to build allies in helping you and ultimately the organization to reach those sort of what seem like pie in the sky activities.
Well, I think that's a critical point because unlike any other function, if you come in and you're the new CFO, you're not going to go in and say, oh, how might we account for receivable? Like you would improve systems and processes and you might have different culture, but you're definitely not starting with a blank slate, right? If you're supply chain but it is a function that does allow you to start with blank slate because very few organizations have it fossilized yet, right? It's such a new and organic or dynamic and growing field. So anyway, I appreciate your time and sharing your journey. It's a fascinating one, and I wish you continued success. Thank you so much.
Thanks, Peter. Have a good one.
If you enjoyed this episode, and I do hope that you did, please join our new LinkedIn group, which is exclusively focused on the organizational thought leader, the person in the corporate world that is using thought leadership as part of their job, whether that's developing thought leadership, whether that's deploying thought leadership, whether that's helping others do so. Please take a look and check out our LinkedIn group. We think you'd get a lot of benefit from that. Thank you.